Hi guys, it's Shreya Mizra from the Health Ninja here. So I'm here to talk to you about caring for a positive COVID person in your home. So most recently the fight has been to flatten the curve, and a lot of talk has been around prevention as well as infection control. So now I want to talk to you about your response to the increasing number of patients that's out in our community and the large number of people that are now exposed to this virus, whether it's in your shopping malls or at the bank or in your place of work. So when you are caring for someone who is a COVID positive patient in your home, they do not need to go to the hospital unless absolutely necessary and unless their condition is very severe. So most COVID patients can be managed at home with your paracetamol for fevers, your Allergex for a runny nose, and you just treat it as the symptoms come along. So basically what I want to let you know is that if you have a COVID positive in your home, everyone within your home will be considered positive to the outside world. So you would isolate yourself and your family in your home for 14 days. So within your home, if, for example, I was the COVID positive patient, I would isolate myself in my room and the rest of my family would keep away from me as best possible. So if possible, if there is a bathroom that the COVID positive person can use, they need to have their own bathroom and their own bedroom. If there is a communal toilet and bathroom for everybody to use, then basically what will happen is the positive person who's going to use the toilet will use the toilet or bathroom and thereafter sanitize down the entire area. Make sure that you are using the mask whilst you are using the loo or the shower. Oh, not necessarily the shower. So once the positive person has then gone back to their room, somebody who is supposedly negative will then come obviously with your mask on and re-sanitize down the entire bathroom. So this is just making sure that if there is any virus left behind in this bathroom, it is wiped down and cleaned completely. So that's basically isolating in a room and the use of a toilet or bathroom. The next thing is when serving a positive person their meals. So ideally, you can put their meal on a plate or a tray and leave it at their door, knock on the door. The person who's inside must wait a few minutes for the person who brought the food to them to walk away, and then they can open the door and take the food. So the reason why this is advised is if for whatever reason, when you open the door, the positive person coughs or sneezes, or they have the virus on their hands and they transfer it to you, you risking yourself, who you being the person giving them the food, you basically risking the fact that you may get the virus and may get sick. So serve their food in the room and as best as possible minimize the contact, as well as have their own cutlery, plates and cups kept aside for them. Reason being is if these cutlery and crockery are not washed correctly, then whatever virus that may be on these plates, cups and cutlery can be passed on to the next person that uses it. So therefore it's advised to basically keep a separate one for the person that is positive. So the next important thing is to maintain contact with your doctor or a doctor at the hospital to keep informing him on how you are feeling and whether your symptoms are lessening or getting more severe. What you need to remember is that the COVID-19 virus can start off with you having mild symptoms, and many people will just have mild symptoms through the process of them getting better, but a few of them will get severely sick. This is when you have to contact a doctor and possibly go into the hospital to be put on oxygen. So in order to do this, you need to have contact details at home. If the person gets sick, you need to know who to contact and how to get them to the hospital. Please watch my next video to find out how to go about getting them to the hospital and contacting a doctor. Please stay safe, stay indoors. Remember, use your mask, wash your hands, clean all frequently touched surfaces, and just stay safe. Until next time, guys. Thank you. Bye.